Next question, in the name of Deputy Stephen Donnelly, 46.
In relation to the specific institution referred to by the Deputy, I'd say that it's a matter for the Board and the management of the HSE to set staffing and service priorities in accordance with government policy. It is part of the day-to-day function of the Board and management of all public bodies to assess, budget and plan for current and ongoing staff requirements within existing resources. Any inquiries relating to the day-to-day operations of St Coleman's Hospital should be directed to that body or my colleague, the Minister for Health. But on the more general level, the position is that Ireland is committed to reducing the overall size of the public service, as I've indicated to Deputy Fleming. I don't agree with the Deputy's assertion that the moratorium is unfair to any particular group or sector of workers. All public service bodies are equal opportunity employers and are committed to treating everyone in the same way, regardless of race or colour, nationality or ethnic origin, religion or religious belief, sex or marital status, family status, orientation, membership of the traveller community, disability or age. The public service has a very, very good record in that regard. Moreover, the reason for any vacancy is not a factor in deciding in decisions relating to the moratorium. It should be noted by the Deputy that a number of exceptions have been granted by my department to cover maternity leave, where the post in question met the agreed exemption protocols in order to protect crucial services. Delivering this reduction would require continued implementation of the moratorium on recruitment, with exceptions being limited only to those essential posts and utilisation of redeployment not being available. I've indicated in a previous answer where there is flexibilities in the moratorium, but in general terms we really do need to reduce the numbers to a manageable profile so that we can reach our pay reduction targets.
The rest of the reply will appear in the official report. Deputy Dunn.
Thank you, Minister, for your response. Minister, I have to say I'm disappointed in a few places. I think, first of all, the hiring moratorium is definitionally non-strategic. It just depends on when someone is sick, when someone is pregnant, or when someone is approaching retirement age. And certainly is not how you get value for money. It may be how you reduce numbers, but it's certainly not a strategic way to reduce numbers. Now, you say that it doesn't discriminate against anybody, but definitionally, if maternity leave is included in the moratorium, definitionally, it discriminates against women. In putting this question together, Minister, let me just read out some of the quotes we've had from female civil servants.
I don't think we'll have quotes.
It's question very quick. I've got the questions going. It's hard enough to go on maternity leave and feel guilty for your colleagues when you're being replaced. Imagine how hard it is when you're not being replaced. It's awful to have your boss put their head in their hands and go, great, well done. And this was a boss to a female staff member re-pregnancy. You cannot plan your family around the troika. So definitionally, Minister, it does discriminate. I'm very disappointed in your reaction regarding St Coleman's and saying it's a matter for the HSE. The reason it's closed is because staff have got pregnant. The HSE have confirmed this. The staff are pregnant. They cannot be replaced because the rules that you oversee and the respite service and the daycare centre have been closed. The HSE has confirmed that. We've discussed it. So it is within your power. So my question is this. Will you supply the cost-benefit analysis regarding maternity leave and what that does? And will you review the very crude approach, which is the hiring moratorium? And if so, will you give us some deadlines as to when you might come back to the House with some answers?
Thank you, Deputy.
Well, I am surprised, I have to say, that the Deputy is so clear in his assertion that a health facility, a hospital, closed because the staff got pregnant. But I will genuinely go back to the HSE and see what the basis of the assertion is. It's a matter primarily for the Minister for Health, and I'll ask him to revert to you directly in relation to it. The Deputy is right on a general principle. There is a certain crudeness about a moratorium. I agree with that. But if we're going to downsize in a very tight time frame, there's no point in getting rid of people if they can be replaced. And we have to, I'm hoping to be able to redefine the mechanisms, to exclude some of the cruder consequences of them, as the Deputy rightly points out. But I have to do this in the straitjacket of the financial burden that we live in and the objectives I have on the pay side to save money. I think the Deputy is particularly well placed to understand those pressures.
Thank you very much, Minister. Very briefly, if you.
So, Minister, if I could just read out to you, the Health Service Executive says the decision. I'm replying directly to Minister Kirlick.
No,
says
I've said that already.
Okay.
So it's just a question.
I'll send it to you. The HSE is on the record as confirming that maternity leave is one of the reasons why the respite centre has been. It's maternity leave and sick leave are the two. Secondly, can I ask the Minister, with regard to Deputy Fleming's last question, the end of February date for teachers is a huge problem. We're hearing it again and again and again.
Well, this
right.
That's a priority question also.
Will you
let the Minister in now, I think.
Will you review whether teachers, if the date can be changed for teachers, because what we're going to have is a lot of teachers leaving the service halfway through the year.
I hope I'm not encroaching on another question that is to come. The Liscan Corla will stop me if I am, but of course I'm alert to the difficulty that the Deputy has identified, and while it is not possible legally to give different dates to different categories of public service workers, we obviously have to have a strategy to deal with that issue as it arises.